High cholesterol can be a problem, although cholesterol is extremely healthy for our body in the right amounts. It supports all the cell membranes in our body. Our brain cells, our hormones, our bile that's used to break down fats in our small intestine. It affects our immune system, as well as many, many other things. But I want to share with you the quickest way that you can lower your cholesterol levels. The first thing you need to do is quit those refined and processed sugars. That means those foods that are in the packages, your sodas, your candies, your cakes, your breads. You get the hint. Too much sugar kicks up insulin levels. Insulin means your body's ready to store more fat. So what happens is if you don't burn the sugar off, it gets stored as glycogen in the liver as well as the muscles. And the excess sugars get converted to fats, primarily triglycerides. Too many high triglycerides can lead to metabolic syndrome, problems with blood pressure, cardiovascular, diabetes, as well as other systemic diseases. You need to reduce the excessive saturated fats as well as trans fats. You want to focus on unsaturated fats that are found in nuts, seeds, avocados, and fatty fish. And you want to stay physically active because regular physical activity will raise your HDL cholesterol, which is a good cholesterol, and lower your bad cholesterol called the LDL cholesterol, as well as your triglycerides. And you also want to maintain a healthy weight because as you lose weight, your cholesterols overall will continue to go down. You must avoid smoking and limit your alcohol because that has positive effects on cholesterol levels. But there's one main thing that I can promise you that will make tremendous changes in your body's chemistry is just by adding one thing, your soluble fiber. And your soluble fiber foods are your oats and oat brands. This is the richest source of soluble fiber, specifically beta-glucans. Your legumes, your beans, lentils, and peas, your fruits, your apples, oranges, pears, berries, and avocados. Many of your vegetables, as well as nuts and seeds, particularly flax seeds and chia seeds, as well as psyllium husks. And when you look here, you take a tablespoon of chia seed and put it in water. Look what happens. Those chia seeds start to swell, about 12 times the size of what they originally were. That's soluble fiber. So let me share with you the main reasons how this soluble fiber lowers your cholesterol levels. When soluble fiber is ingested, it dissolves in the water present in the small intestine, and this forms that viscous gel-like substance. And that gel traps cholesterol and bile acids within the small intestine. Bile acids, which contain cholesterol, are released into the small intestine from the gallbladder. And normally these bile acids are reabsorbed back in the bloodstream from the small intestine and recycled by the liver. However, in the presence of soluble fiber, this interferes with this process. The trapped cholesterol and bile is then carried through the digestive tract and ultimately excreted from the body in feces. So when bile acids are excreted, the liver must use more cholesterol from the blood to produce new bile acids, which helps lower our LDL cholesterol levels, which is our bad cholesterol. You see, soluble fiber is a prebiotic. We've heard of prebiotics and probiotics. Our probiotics is what flourishes our microbiome, that keeps us healthy. It helps build our immune system. But those probiotics in your gut eat those prebiotics, which is soluble fiber. And you start secreting short-chain fatty acids within the gut. Those short-chain fatty acids reduces inflammation. And inflammation is a big, big killer when it comes to cardiovascular problems. The soluble fiber will keep you full, will keep you satiated. The soluble fiber will slow digestion down. The soluble fiber will limit that insulin spike, allowing glucose to get into the cell slowly so you don't get tired after your meal. And this keeps insulin from rising. Your body will not store excessive fats. So let me make it real simple for you. If you want to lower your cholesterol levels, the easiest way, increase your soluble fiber. Along with the other things that are important, getting rid of excessive processed refined sugars, get rid of the packaged foods, the breads, lower your saturated fats, more polyunsaturated and unsaturated fats are more healthier. You want to increase a little more exercise, get your sleep, drink your water. But the key thing is when you put soluble fiber in your gut, the bile acids that's coming from the gallbladder, originally from the liver, that's designed to digest the fats. There's cholesterol in those bile acids. The body needs cholesterol to make those bile acids. So what happens is that cholesterol that's already in your intestine, along with those bile acids in the small intestine, it latches onto it. And it pulls it out of the system, right out of your waste, out of your system. So now, that cholesterol, as well as those bile salts, cannot be recirculated. So the liver says, wow, I need more cholesterol to make more bile salts so you can do what needs to be done inside your body to digest those fats. So the liver searches for the bloodstream, looking for that cholesterol, and pulls more out. What happens? It lowers your cholesterol levels. No-brainer. Remember that a little exercise is so important, because what that does is that raises your good cholesterol levels, called the HDLs. And HDL's function is to go to the bloodstream through the blood vessels and search for those LDLs, the dangerous cholesterol. That's the cholesterol that plaques, that causes clogging within the arteries. It grabs onto it, latches back to it, it takes it back to the liver so it can be excreted out of the body. But remember, when you have high cholesterol, you're usually going to have high triglycerides, and you're usually going to have low HDLs, which is your good cholesterol. But if you start following this simple strategy, I know you'll do great. Please share this video with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandel.